guys, I hope you all are doing well. So today I'm going to share how I passed my NCLEX exam. I didn't pass on my first attempt, didn't pass on my second attempt. I passed my exam on my third attempt. I know mostly might be some people will be thinking, okay, what's the big deal if you pass your exam on the third attempt? But for me, it was really big deal because whatever I did with my self-study. I didn't get any mentor during my practice time. When I was preparing for the exam, I didn't get any help from outside. I just figured out, okay, where I have my lackages and where I'm lacking in my competition, where I need to practice more, what's my strength and what's my weakness. I did by myself. So in my first attempt, I used Archer, and I thought might be question bank is okay, it's totally fine to use that and I can pass the exam. But unfortunately, I did not pass that. Then second time I did same, I used Archer question banks, and also along with Archers I used Klimek Mark notes and his lectures. I heard all his lectures that were present on YouTube before, but right now I don't know if it's there or not. And again, I did not pass the exam, and NCLEX was kind of my major goal, that I really needed to do that if I want to pursue something in my life and want to grow more in my nursing profession, because I really love my job. If I'm working, I'm really happy. And I was RPN already, but still, there is in our mind, especially I think our society, they always like, okay, did you pass your NCLEX or not? And especially the people who already passed, they gonna ask you, and then that time you won't have any answer if you don't pass. And I was one of them, because many of my friends and my colleagues, they already passed the exam, and I was like, okay, keep delaying, it's okay, I can do it. But still, the time will come, then actually you need to answer, okay, why you didn't go for exam and why you didn't pass the exam. Okay, so anyways, so for first attempt, second attempt, I didn't pass, and on my third attempt, I got very, very serious this time. I was like, okay, I really need to work on this. I have to get this done by 2-3 months, and I cannot delay anymore. So I started reviewing resources, and first this time I was like, okay, what's the actually reason why I'm not getting it? There should be something I'm missing. So I started work on me, like I started reviewing the content first. Guys, content is very important. If anybody, if they are going without reviewing their content, just with the question banks, I am sorry, content is really important. You are not going to pass the exam. So content was kind of basic key to pass the exam. So I started like system wise. If I am doing GI system today, I am going to attempt 85 questions on the GI system. If I am doing cardiovascular, then I have to attempt on 85 questions on cardiovascular. That's how I worked on me. It really helped me, because the chart, the graph I see after, it was going up only every day. Each and every day I was getting more than 75%, which was quite satisfied for me, because that gave me extra strength and it boosted my confidence as well, because I feel like, okay, I can do it, because I'm having good grades now. And then I did readiness assessment as well. So yeah, I got this, and then I was getting very high in my readiness assessment. So I was pretty confident this time I'm not going to lose this. Okay, so unfortunately I was really prepared, but I could not go for exam because there was something happened in my family, very personal. My father, he got sick in that time, so I have to go back home India, and I spent a month there. Actually, I was prepared, but I could not give the exam. And when I came back from India that time, I knew that I can do it. It's not a big deal for me. So I started. Now I was already done with my content. I knew each and everything. So what I did, I listened Klimek Mark on YouTube, and the videos are still there actually. So I can give that link also in the description where I used to watch the videos. And along with that, best thing I did, that my best decision was to watch Dr. Sharon. She's best, I could say. Like, she's one of the best mentor. I used to watch her videos. If you don't know the content also, seriously saying, if you don't know the content also, she will teach you methods how you can answer your questions. Dr. Sharon, she is actually with Klimek Mark. They both are together, and she's giving review on his chapters and whatever we studied from Klimek Mark. She's giving reviews, but the best thing, she's suggesting how you can answer the questions. So 10 to 12 questions which we are getting at the first, it's actually based on our general knowledge, like basic knowledge, we can say. So you don't need to know the content for each question. You really need to know how you answer the questions. So the 3 tips which is really important: first of all, you please review your content. It is important. But second thing, the extremely important thing, is that how you are answering the questions. So we all know we can eliminate 2 options very easily, that we all know. But mostly the students who got stuck, it's in the last 2 options. And that last 2 options, sometime mostly students, they are choosing the wrong option, which is not related to question. And it's just a trick, because the Nclex wants to examine your critical thinking. So we need to see how we can imply our safety for the patient, which is very important. Patient safety, patient safety, patient safety is extremely important in Nclex. So what we need to do, if when we are attempting the questions, when we have left only 2 options, please read the question again. 2 options we can easily eliminate. Read the question again. You will automatically see the difference. Wow, this is why we are not getting our exam in a proper way, and we are unable to get the right answer. So always read the question, and then from these 2 options you need to choose the right answer. Trust me, if you are going with these 3 major tips, the first one is content. Okay, it's important. The second one is that how you are attempting your question, how you are using your critical thinking. Not everybody's mind stability is the same, but if you will work on these 3 things and watch Dr. Sharon on YouTube, she is mind-blowing. She will teach us the way how we need to attempt the question. Because when you are doing Nclex, the first 10 to 12 to 15 questions are the basic questions, which they just assess your basic knowledge. So your graph needs to go up, and then after you will get medium and more hard questions. But these 15 questions are your basic questions, and it really needs to be correct. This is how your graph will grow, and this is very important to pass the exam also. So these questions needs to be correct all as well. And I hope this helped you, everybody. And my suggestion is, please review your content, go for your practice after that, and yes, you got this. You can pass the exam easily. And thank you so much to watch the video.